But welcome to the Access to Specialty Care work group meeting. So I want to welcome everybody here. So today we're going to have Abby give us a kind of an intro to what is happening today, what had happened in the past, and what's happening today. There's a nice overview of the whole process that HCPF and its partner, and I forgot the name of the partner, the one who's going to be operational for it, Abby, is
Safety Net Connect.
what is it?
It's Safety Net Connect, or
Safety
you can
Net
call
Connect.
them, yep, SNC.
Right. We're going to have Abby, who's with HCPF, give us the kind of the up-to-date lowdown on opening day, which is today. So Abby, go ahead and start if you would.
Thank you. Yeah. Good morning, Aurora Health Alliance. Good morning, HCPF colleagues. We're excited to be here today. Today is our go live day. It's our launch day for the Colorado Medicaid eConsult platform. So we're really excited to just get this moving. All right. Yep. So like Rich said, this is an overview of Colorado Medicaid eConsults and what's been going on and what we're looking forward to in the future. So we're going to go over that general overview, talk about some program goals, talk about specialist network adequacy as it stands right now, compensation for providers, and steps to participate.
Very good.
So we've all kind of heard this before, but we'll go over it again. eConsults provide asynchronous, meaning store and forward communications between a primary care medical provider and a specialty provider. And eConsults allow those PCMPs to seek specialist advice electronically, expediting care and often eliminating the need for an in-person specialist visit. eConsults provide a documented summary of interprofessional consultation as well. So it's nice to have that documentation available. Go live is today. So we are live and operational as of February 1st, 2024. And Health First Colorado providers have access to a free, secure, and electronic consultation platform through coloradomedicaideconsult.com. That's the web address that you can go to. So we've been working on this for quite some time, but in the past few months, we've been working with a lot of engagement with our RAIs and PCMPs. We've been working on onboarding physicians and organizations that are interested in doing some training. Today is our go live day, and then we're looking forward to doing more onboarding and training throughout 2024. And we do have some goals in mind for the future. Obviously, our biggest goal is to increase access to specialty care for our Medicaid members. And we've also implemented a fee-for-service billing option outside of our eConsult platform. And there's some criteria that is listed in our billing manual. The link is right here to get to that. That'll tell you what criteria the department has outlined for third-party platforms that we will reimburse for. And we are also going over our rates. There's reimbursement rate review happening. And we are also looking at adding specialty to specialty eConsults. Okay, so as far as the adequacy of our specialty network right now, this is what we have available as of go live today in adult and pediatric specialties. And then throughout 2024 and right now, our wonderful partners, SNC, are working on recruiting more specialties for us.
And SNC, Safety Net Connect.
Safety Net Connect, yes. And they also work in partnership with ConfirmEd, that is supplementing our local network of specialists with the national network.
Okay.
Yeah, so lots of specialties available, and we're just looking at expanding that network in the future. As far as compensation goes, PCMPs will receive $17 fee for service per closed eConsult. and specialty providers will receive $35 per closed eConsult. And one thing to be aware of is that ConfirmEd will actually be paying specialty providers directly for closed eConsult. And here are our steps to participate. So if you guys are interested in getting in contact with HCPF or with SNC, one of the greatest places to start is emailing SNC at coloradosupport@safetynetconnect.com, and that can initiate the enrollment process. They'll send you your enrollment forms and everything, and then they'll be reaching out to you for training and registration, and we can go from there. And then if you're interested in looking at some upcoming stakeholder engagement opportunities, or like Rich was saying, the previous webinars that we've had that were recorded and will be available on our website, I do believe that our January 10th specialty webinar should be on our website by the end of this week. And you can visit us here at our website if you want to learn more. And that's all I've got for you guys today. Are there any questions or comments or feedback?
I would say those who do have questions, and hopefully there'll be some, just go ahead and blurt them out.
Oh yeah, let me check our chat as well here. Yes, we can absolutely.
Good afternoon, everyone.
Oh, hi.
Oh, go ahead.
Hey, Keith.
Hi. Go ahead, Abby. I'll wait.
Oh, no, you're fine. I was just looking at the chat to see if there were any questions. And it looks like there was just a question about the slides. Yes, we can absolutely make sure the slides are available to you guys.
So 2 quick questions. The first is, how is this information getting out to Medicaid participants, so to patients? And then I work for UC Health, and I'm not familiar with our group that actually would want to know about this. So the question is, how is it being communicated to health systems and others that might want to disseminate it to that same patient population?
Awesome question. I think part of that is the stakeholder engagement process that we're going through. We've had webinars. We also reach out regularly via some of the different newsletters and forms of communication that HCPF has to RAISE and to providers. So we're reaching out that way. And
Abby, I can actually jump in here.
Thanks, Matt.
Yeah. So in terms of communications to members, this is a provider facing tool, so we won't be communicating this directly to members. Members will always need to consent anytime that there's a telemedicine service being rendered that the provider is going to bill us for. So they'll need to consent on that end, but we're not communicating the availability of this tool directly to members in any way. As far as health plans, as Abby said, we're engaging in in a variety of ways with stakeholders. We send out monthly bulletins every month where we've had a monthly update on this. We also are engaging with all of our health plans, our RAISE, in engaging their providers and getting them onboarded for the platform, and they'll be doing, they'll be accountable, at least in some ways, for collecting information for us on who in their regions are engaged with the platform. So a variety of ways that we're going about that.
Excellent. Thank you.
Yep.
And Keith, if you ever have any additional questions or feedback for us, we'd love to hear from you. You can reach us at this email address that's at the bottom of this slide here, hcpf_econsult@state.co.us.
And I'll have just a question, Matt. You said the RAISE are intimately involved. I would think they would be, because this has always been a serious issue for them. Do you see them jumping on board, excited about this, that they're reaching out to their people and getting the word out? And then related to that is how many providers are involved? That was a question in the chat right now.
Yeah, so the Rays are, I think eager to outreach and get their providers working, and that sort of varies region to region. The other thing I'll add is there's sort of an interesting dynamic here in that, we are opening up the fee for service benefits. So I think it's going to vary between Rays, right? So this is going to be a tool that I think the value add is going to be mostly in, or probably, disproportionately in the regions where they don't have access to existing eConsult platforms. So they don't have these, in the urban areas, Denver metro area, some of our especially bigger providers, have their own tools that they're going to be able to use and bill fee for service. They're not necessarily going to need to use our platform. And then on the Western Slope in Region 1, they have an existing platform that's sort of separate from the Colorado Medicaid eConsult platform. It's managed by the same vendor, Safety Net Connect, but those folks are going to be able to use that platform because Rocky Mountain Health Plans is offering, it's already integrated into the QHN portal for those folks. They're offering it to all their providers. So we'll probably see, less providers over there, but not that they won't have access to an eConsult platform, just that they won't be using this one specifically. So it kind of depends on the region and, where I think the utility for providers is going to be, or where, where the most value add is going to be for those providers. And as far as how many providers, so on the PCMP side, in terms of like the primary care providers, I think just have a handful right now that are currently in the process of training to use the platform. And then on the specialty side, we have, all those specialties that we listed, we have at least one in each specialty. Some of them have two. And then the idea is obviously to grow that, over time. And so we have contract provisions for a vendor that they're required to, grow by a certain amount every couple quarters or so, the number of providers that are accessing it on the primary care side. And then obviously also they need to have sufficient specialty capacity to meet the demand for that as well.
Mandy's asking a question. Can you explain more about the fee for service reimbursement? Does anybody want to expand on the question on issues with fee for service?
At a high level, as I mentioned, folks who already have an existing platform that they're using for eConsults are able to bill fee for service, whether that's on the primary care side or the specialty side. And so not all eConsults will be required to use our platform. There is some, I think, criteria laid out in the billing manual as to the platform needs to meet certain criteria in order to be considered, I guess, department approved. But any provider that has an existing tool that they use for eConsults that meet that criteria can then bill fee for service. So hopefully maybe that answers your questions.
How do you see the platform undergoing evolution in the next year? What plans do you have for it? And then I'll have a follow-up, but
yeah, so I think in the next year, we're primarily going to be focused on growing the platform, getting, as I mentioned, getting more both primary care providers onboarded, as well as specialty providers, if, sufficient to meet the demand if necessary. And then also, we're going to be working, we have enough funds set aside every year to integrate our platform with about 4 EHRs. So we're going to be working with our health plans and providers to determine, what sort of the best allocation of those resources is going to be. And And really that means like who is interested and willing and able to integrate with the platform, because again, what this will provide those providers is, for those that don't already have some sort of existing tool, they can integrate their EHRs with our platform so that they don't have to go outside and log on to a separate tool or anything to submit these eConsults. They could do it directly within their EHRs. And yeah, so for the providers for which that would be useful, we're going to be sort of targeting and trying to figure out who to target for where that makes the most sense, and working on those integration discussions.
And is there an advantage? Can you see an advantage for providers who have their own eConsult platform to also use this one? Or in most cases, will they say, well, I don't really need the HCPF platform. I'm fine with what I have. Any thoughts on that from anybody, Matt or anybody?
Yeah, I mean, it probably depends. I think probably in most cases, the providers who already have this sort of tool probably already have a pretty robust network of specialty providers. Those are going to be like your CU Medicine, your Denver Health. There may be some who maybe fall in between, who might have some sort of existing tool, but they don't have access to the same sort of wide array of specialties that our tool might have. So I think it might make sense for some folks, but for some of the bigger folks, I suspect that that it won't make sense for them to use our platform, and they'll just continue to use their own.
I could see where maybe they see specialists that the HCPF platform will direct them to, that their platform might not. So that would be an advantage if they see that. So probably be good for them to get on and try it out and see what's available.
Yeah.
And Rich, I just wanted to point out that one of the other, I think, shared benefits of the eConsult platform is that a lot of these visits that patients have to specialty physicians are a one and done visit. There's not a lot of ongoing care. And so something across the board, in Colorado, a shared benefit for everybody, regardless of which platform that they're using, is hopefully we are reducing the burden on our local existing specialty physicians and allowing those people that really do need those in-person visits to access that care more easily, and things that are more routine, not non-emergent, those things can be handled via eConsult in an expedited manner, and free up those specialists to see the people that really do need that in-person care.
So this platform that is being unveiled now, would you guys see it as a little bit more its ability to refer and to an in-person if it turns out that this is necessary, compared to others, which is one and done? Kind of seeing it that way?
So there's no functionality within our tool to convert to a face-to-face currently. Anyway, there's no functionality to convert that to a face-to-face referral. So the utility for our tools is really going to be for those one and done, as Abby was saying, than it is going to be for that as part of like a broader sort of referral pathway, I guess.
And then if in the course of the eConsult, the primary care provider says, I really need to refer that person, and the eConsult guy, the specialist, also agrees, yeah, looks like we should do a face-to-face. What's the provider to do if he doesn't really have relationships with the specialist out there that is needed for his patient? So what would you think that he or she should do to do that now?
So again, I think these are going to be more for those instances where, the provider is just, is looking for just a little bit more information so that they're able to manage the care of the member themselves. It's not going to be, I think, useful for those, I think, more complex cases. As to what they would do and that's not to say that some of these won't end up in a face-to-face referral, but what we found in talking to our vendor and partners in areas where they're already sort of using this tool is that's sort of where the utility is. And we are, I think, exploring the option of, there's always the option of adding that functionality to convert this to sort of to be able to convert that to a face-to-face referral. But as of right now, they would just need to follow their existing sort of referral pathways, right? So, we have a data element, that'll indicate like how the referral is closed in our system, or how the eConsult, I should say, is closed in our system, that, the specialty provider recommends a face-to-face referral. But then it would be up to the primary care provider to make that referral and follow through on that end.
The specialists they're nationwide, that it's Safety Net Connect that's finding them?
Yes, they are. There is a national network that, we are sort of giving priority to the Colorado-based network. And so, they've been working hard to really onboard and get those providers. All of our providers will need to be licensed to practice in Colorado and then enrolled with Colorado Medicaid. But some of them are based in different areas nationally. And then, providers will have the ability to select a Colorado-based provider, so somebody they might be more familiar with, or maybe they have an existing referral pathway with. They can always select a provider by name, but sort of the default routing process will go to sort of the first available provider with priority towards the Colorado-based network, if that makes sense.
Okay.
Matt, you kind of touched on this, so question for you and Abby. One of the things we've always run into is that the problem with specialty care access is capacity. And the idea is that this kind of releases some of that capacity. If we're not filling up with patients that really didn't need to see a specialist, their primary care just needed a little more information and they could have taken care of it.
Yep.
Then the thought is we'll have more openings. Do we have a way of tracking? And I know this is going to take a while. It's going to take a long time, but at some point we need to be able to see that eConsult is in fact moving the needle, so that we don't have as many people clogging up in-person visits. How are we going to track that and evaluate that?
Yeah, so we do have an evaluation strategy where we're looking at some of these things. I don't know that we expect that necessarily that specialist utilization will go down as a result of this, right? Because you have all that sort of pent up demand, right? That's going to be released hopefully by having this access to this tool. So, but we will be sort of looking to analyze, what is going to be the effect on utilization over time, and what is going to be the effect of utilization for specialty care, right? And then utilization for specialty care specifically for the members who are engaged in this tool, with this tool, or who have a service rendered under this. So those are some of the things we're looking at. We're also going to be looking at I think specialty volume overall, and then sort of try to tie it back to, again, to the claims that are submitted for members under this tool, and then also fee for service. So I don't know, so all of those things, I guess, are things that we're thinking about in terms of our evaluation. But it, as you said, it will take some time, I think, to sort of tease that out, because it'll be, I think a year or two before we get any sort of meaningful sort of results. And we don't expect, there to be a flood of eConsults on the first day or anything like that. This is going to be a process by which we develop, capacity for this around the state. So
In terms of our safety net providers, the federally qualified clinics out there, I'm thinking they probably already have an eConsult program, but are there some out there that don't, you think? That's may not have a definitive answer, but I'm just kind of wondering.
yeah, and I don't have all of that data, but what I can say anecdotally is that some do and some don't. Some are plugged into sort of existing sort of eConsult networks with some of our bigger providers. I know at least 3 or 4 FQHCs in the metro area, but I think probably the rural FQHCs are probably less likely to have something like that, although they may.
Thank you all for all of the work that you've done over, I don't know, 2 years of developing this. Our pointed questions in this group are not to just brush over the fact that the eConsult platform is here and it took a lot of work. So we're very grateful of that. And then I have just a wonky question. For the consent form, does that, the wording of that, does that go through the like community boards or to get member feedback so that it's making sense for them? I know in a consent sign off, sometimes that's intimidating, and was concerned about community input.
Yeah, so we don't actually manage all we do is require the provider to attest that they've received consent from the member. We don't actually manage that. So that would be, that's up to the individual provider to make sure that they're in compliance and that they, and each one will probably have a different sort of consent process. That's not something that's managed by us, though.
Thanks for the clarification.
Yeah.
And yeah, like Mandy says, this is a wonderful day. I'm so happy to see this happening. This expands the capability within Colorado for eConsults. It's already here, I know, but especially for rural providers and maybe the smaller primary care providers, it's probably should be, I would think it'd be a godsend for them.
I'm particularly interested in how much the uptake for the fee for service on existing eConsults goes. Hopefully that will only incentivize the bigger systems to continue to do so and offer the eConsults and build that out a little more.
Absolutely. Thanks, everyone.
Yeah, bye-bye.
Thank you.